We're coming to the second part of presentation. We will talk about very low arterial blood pressure, orthostatic hypotension. And I mentioned to you, whatever I will talk about the people with spinal cord injury, it's also applicable to individuals with Parkinson's disease, multiple sclerosis, peripheral neuropathy, who are suffering also from orthostatic hypertension. But we also sometimes see, as you're aware, orthostatic hypertension in elderly individuals who forget to drink enough water. By International Autonomic Society and American Autonomic Society guidelines, orthostatic hypertension defined by drop in systolic arterial blood pressure by 20 millimeters of mercury and diastolic blood pressure by 10 millimeters of mercury when person assuming sitting or standing position. At the same time, this is typically associated with increase in heart rate due to reflex control. Be aware that most of people with spinal cord injury or with orthostatic hypertension will present with symptoms of drop of blood pressure within the first 3 minutes. But we do have individuals who will have delay onset of orthostatic hypertension. Some of them will drop blood pressure after 5 or 10 minutes of sitting. That's why be prepared for this as well. Simple act to manage when orthostatic hypertension triggered. Just discontinue procedure which we're doing, put patient back to the supine position, and this typically helps. On the next slide, you will see continuous blood pressure monitoring that conducted in my autonomic clinic in a person with a cervical spinal cord injury, also motor complete, sensory incomplete, and this individual is only 3 months after the injury. As you can see initially, supine arterial blood pressure in this case was already low, 99/61, heart rate of 74 beats per minute. Person totally asymptomatic. As soon as we tilted this patient in a clinical test, what we do typically in autonomic clinic, we're using tilt table assessment, and person will be tilted up to 70 degrees, and you will see arterial blood pressure drop, blue line. Green line, mean arterial blood pressure drop, and purple line, heart rate, and you notice heart rate start to increase. And most importantly, person immediately start to complaints on dizziness, lightheadedness. Blood pressure dropped to 73/47 beats per minute. Patient was able to sustain whole 10 minutes of tilt table test. As soon as we put him down to horizontal position, you see his arterial blood pressure normalized, mean arterial blood pressure going back to normal, heart rate decrease, and he become asymptomatic. This is a typical example of orthostatic drop in arterial blood pressure with tilt table test. The same happening when person seated up or standing up. That's why most commonly we see that many people, up to 70% of people with spinal cord injury within the first acute period of spinal cord injury experience this condition. We have to deal it in the rehabilitation facilities because sometimes patients cannot even participate in rehabilitation because of arterial blood pressure. And we have specific tricks for this, and I will share with them this information. Typically later, after rehabilitation, many people with a low level of spinal cord injury recovered fully from orthostatic hypertension. However, people with mid-thoracic and cervical spinal cord injury will continue experience orthostatic hypertension for the rest of their life. Plus, if something additional triggers will happen, for example, hot shower or hot weather exposure to the sun, or they forget to drink enough water, they could develop and worsen their stable arterial blood pressure, and their blood pressure will go even further down. Also, very important aspect to realize that with low arterial blood pressure, cognitive function are affected in people with spinal cord injury. They are slow. They cannot sometimes realize what's happening until their blood pressure come back to the normal level. That's the typical signs and symptoms. There is possibility of loss of consciousness and fainting. People will complain of dizziness, lightheadedness, fatigue, blurred vision, and muscle weakness. And severity of these symptoms could vary from person to person. And again, I can tell you some of the patients could be totally asymptomatic until they faint. That's why be prepared for this as well. What we can do, what we have to recognize. Sometimes our medical intervention, pharmacological agents could predispose people for lowering arterial blood pressure. That's why review medications that could result in lowering arterial blood pressure. We have to educate our patients about this unstable blood pressure presentation, people with spinal cord injuries, that they and their caregivers will be aware about both high and low arterial blood pressure. When they suddenly decided to rush to the washroom and stand up quickly, for example, people who can still stand up, could drop arterial blood pressure. Diet. Large meals could contribute to the lowering blood pressure. As we talked with you previously, postprandial hypotension is commonly seen in people with spinal cord injury. That's why we commonly recommend, don't take one big lunch or one big dinner. Divide meals during the day to 5 small portions. Obviously, avoid alcohol, avoid large carbohydrate pastas, dinners, and lunches. Regular physical activities could be helpful for the people with spinal cord injury to maintain their blood pressure, but still do remember that because of lack tonic sympathetic activation from the brain to the spinal cord, even Paralympic athletes who are in a perfect physical shape still experiencing episodes of orthostatic hypotension because we cannot train poorly controlled sympathetic activity in spinal cord. We also utilize some additional devices such as abdominal binders or pressure compression stockings could be helpful for maintaining arterial blood pressure. Environment control. We become hotter and hotter in Vancouver. That's why just recently, as you know, air conditioning were recommended and were given by BC Hydro to people with disability. We have to support this initiative. It's a very helpful measure for our people with cervical and mid-thoracic spinal cord injury. Management of orthostatic hypotension. I mentioned already some of them. Non-pharmacological, good hydration, very crucial. Do remember, there is a very challenging issue to recommend person with spinal cord injury drink more. If they drink more, they have to catheterize more often because their bladder will be distended. And if blood over distended, they will develop autonomic dysreflexia. That's why it's a balance. And person with spinal cord injury and you as a caregiver and we as a physiatrist always discuss these issues. Typically, we recommend to drink 2 to 2.5 liters of water a day, and person has appropriate timing of catheterization if he or she catheterizing. If person has 4 liters of suprapubic catheters, then at least this is not an issue. It will go out without any problems. At night, it's recommended that you can recommend patient to elevate the bed rest to the 30 to 40 degrees. It will help with some regulation of the hormonal during the night. Pressure stockings, there are still discussions how helpful it is, but it has to be very tight pressure stockings. And you have to also be aware that if it's very tight, patient could develop pressure sores. That's why, again, has to be used carefully. Abdominal binder, very good evidence that abdominal binder, which appropriately put, could support arterial blood pressure and help with orthostatic hypotension. Pharmacological management. Midodrine, Gudron, fantastic short-acting alpha-adrenomimetic. We are using in the practice of JF Strong Hospital a lot this medication. Remember that it will not start immediately. It's need about 45 to 60 minutes after first initial oral intake. It lasts approximately 5 hours. That's if person active for 8 to 10 hours a day, we sometimes recommend to use it up to 3 times per day. However, don't order it for the night, because person with spinal cord injury could experience supine hypertension, that they typically do not order it 4 or 5 hours before they're going to bed. Fluranef, fluorocortisone, mineralocorticoid, also very useful agent for management of orthostatic hypotension. Again, be careful with elderly individuals, particularly don't order it for the night because of supine hypertension.